Hello and welcome. Appreciate you being here. For most of you, you're watching this on recording. My name is Ryan Jaten. I have the pleasure to be here today with Dr. Kenneth Hill. We have a lot to talk about, a lot of great things that he has developed. Want to get in and put him on the spot and ask him a bunch of questions about some of the things that he's developed that can help both patients and healthcare professionals literally all over the world. Dr. Hill, appreciate you being here.
Thank you for having me.
Before we get started, do you mind if we just jump in and do some official introductions? Tell us about where you're from. Tell us about your background, what you currently do, so that we can set the stage.
Very well. Yeah. So my name is Dr. Kenneth Hill Jr. I go by JR. So all my friends call me JR, so we can drop the formalities and we can go by that.
Perfect.
I was born in central Pennsylvania. We moved around a lot as a child. Went back and forth between Pennsylvania and Ohio. Graduated high school at Jackson, Ohio, which is in the southeast area of Ohio, is a coal mining community. After that, I went to college at Lincoln University, which is the first HBCU, or historically black college university in the nation. That was south of Philadelphia. Spent 3 years there. Got a degree in chemistry with a concentration in Japanese as a foreign language. At one time, I was fluent, but no longer that way. Following that, I went to medical school at Penn State University College of Medicine in Hershey, Pennsylvania. Graduated there, applied and got accepted into neurosurgery, also at the Milton S. Hershey Medical Center in Hershey, Pennsylvania, where I did my internship, residency, and chief residency in neurosurgery. Applied and then transitioned to my fellowship at Emory University in Atlanta, Georgia, where I was the first fellow in surgical neuro-oncology and skull-based surgery at that program. Completed that and stayed on staff at Emory for about 4 years. Before I got recruited back to Penn State to be the director of the neurosurgical program at one of their satellite hospitals. Spent 3 to 4 of the years there before I got recruited to Jacksonville, Florida, which is where I currently work.
Awesome. That is quite the impressive CV, I must say. And so you're a neurosurgeon.
I am a neurosurgeon. I am trained to do surgery on the brain and spine with specialty for what I call the critical area of the skull base.
Okay. Well, luckily for me, we are not here to talk about neurosurgery. I can say the word and I can introduce you, but I think you might lose me after that. No, today we're here to talk specifically about something you developed called the MINA app. In fact, it's at minaapp.com. For those of you that are watching this, I'm sure you've already been to the website and had a chance to visit with a member of our team and learn a little bit more about it. Today, we get to sit with JR.
Correct.
And I just want to make sure we drop the formalities. I have a chance to visit with JR and just really, like I said, put him on the spot, ask him a bunch of questions to really see how this can be a win-win for patients and healthcare professionals. So we've all heard the phrase, I'm sure it's quite cliche, but they say that necessity is the mother of all invention.
Correct.
We're going to talk about MINA app, talk about what necessitated this. How does a neurosurgeon step into the technology field? Like, how did this whole process transpire?
Well, had no plans on doing this. I'll be clear about that. But it started many years ago. So my wife, who I say is the smarter Dr. Hill, is a pediatrician. And we were just kind of sitting around the dinner table, and we were discussing frustrations within the healthcare system. And one of the key frustrations that led to the development of the MINA app was whenever our patients come in for their clinic visits, even if they're on time or even within 15 minutes of their scheduled time, where required or still be willing to see these individuals. But when they do show up, they don't have their paperwork done. And this paperwork is standard information. All healthcare providers know exactly what those questions are. We learn it very early in our training. We know it's past medical history, past surgical history, allergies, medications. Even though that information is standard, we haven't really standardized it. And it's required that we ask this each time, because even if you're going back to the same provider for your entire life, that information is not complete. The most accurate information comes from you as the patient. And in between visits, you may have had an encounter outside of the catchment area of our electronic medical record system. So it is important that you provide us with that updated information so that we can provide you with high quality care. But what that does is that if you show up for, let's say, a 1 p.m. appointment at 1 p.m. or 1:15, you don't have that paperwork done, and we're going to hand that to you. And it could be in the form of a paper, or a pad and paper. It could be a tablet or some type of electronic version. But you're going to spend the next 15 to 40 minutes filling out that information, depending on how in-depth that medical information is. So now, by the time you actually get roomed for us to see you, you're a half hour, 45 minutes, sometimes an hour late for that scheduled appointment. And my wife and I just said there has to be a better system. So we kind of tossed ideas around for a while. We thought there has to be an app for that. And we looked for it, and there are different apps out there, but there was nothing really doing what we needed. And we needed to make sure that we captured that information in its entirety, be able to convert that into a form that we can communicate it efficiently, and make sure that it is in a format that our patients, it's very user friendly, that even the marginalized or those that don't understand medical terminology will be able to complete. And then on the backside, make sure that it helps us, a provider, capture that information.
Yeah. So the question, I'll ask you a question I'll come from a patient's perspective. Okay. If I go in to see my healthcare provider and I'm 10 minutes early, I fill out my paperwork and I'm on time, and I sit there and I wait and I wait and I wait. Eventually those frustrations and eventually just the resentment is going to be it's going to be aimed at the healthcare provider, right?
Correct.
But in reality, you're talking about somebody coming in 10 minutes late, filling out 20 minutes of paperwork. By visit 4 or 5 or 6 in the day, your entire calendar has now shifted an hour, 2 hours, 3 hours, to where not only am I waiting, but you don't get to go home on time. I mean, this is a reality. Like, this is happening it's not just you. It's happening to a lot of people. Is that right?
This is the system.
It is the system.
This is our current system.
So I'll just ask you a personal question because I'm just curious. When I'm sitting there getting frustrated because my appointment, I'm there on time, but I don't get to see you for 40 minutes. Does the patient typically come in and take that? Like, are they rude to you? Or do they take it on you? Like, you can feel it, right? Like, oh, I'm behind by an hour. You know that people are upset.
Yeah. It at least for me, which means that it's across the system, it is an accepted part of the process. And I spend most of my days apologizing for being late. And the bottleneck is not necessarily readily apparent, but because of the system, the way it is, I feel it, I see it. And I actually was speaking about MINA to an individual recently, and they said that they intentionally become passive aggressive the longer they wait for their appointment. And I think it's fair to feel that way on that side, not understanding the whole system.
Sure.
And it's not, I'm not going to judge him for that, but
right.
That's what he said.
But I mean, but they don't just take it on you. They take it on the front desk.
Correct.
They take it on the nurse. They take
Correct.
it on the trio. Like,
correct.
Everybody has to pay the price, when in reality, it started with the patient 3 or 4 ahead of me.
The system is broken almost the second you walk in.
Okay. So I think that's clear to me and probably clear to everybody. And I mean, healthcare professionals experience this on the daily.
Correct.
Let's talk about specifically how the MINA app starts to get you your calendar back, starts to unwind some of that apology that you're experiencing throughout the day.
Correct.
Tell us exactly how that is bringing some of the control of your schedule back into your...
So what we did is we created a free smartphone application. So, and it's completely offline. So you don't need cellular minutes. You don't need connectivity after you download that app. And it is creating the standard health history form, which all of our healthcare providers know exactly what that is. It also includes things like immunizations and health maintenance, which will record things like hemoglobin A1Cs and blood pressures, and it standardizes and puts it into a smartphone application. Now, the thing that really is the groundbreaking and most revolutionary method of this is it takes that information and it encrypts it into a QR code. So now whenever you go to your doctor, instead of handing out paper forms or tablets, is you show a QR code, and the providers, and all the providers have, cameras on their intake at their staff where they're taking individuals to take pictures. You just use that camera, you capture the QR code, and there's your.
I have it loaded on my phone. I have my app. There's my QR code.
And the unique nature of it is that is the patient information.
Okay, I asked you this earlier. Like traditional QR codes, when you scan them, it is an entry point into a database somewhere.
Correct.
Like a URL or some type of data bank where this is just the gate. This is the key to get into my data on a data bank. What you're saying, and I just want to be really clear about this to the other healthcare professionals that are watching this, there is no data bank. There is no breach possibility. This is encrypted into the QR code.
Correct.
So that the data resides locally, not locally on your phone in some kind of hard drive. It's in the QR code.
It is in the QR code. That is the data. And so talking about security of information is, whenever you scan that information, and you're absolutely correct, there is no potential even data breach because you are sharing that information with who you need to share with. We do not have access to that information. Our technology takes the traditional encryption method of the QR codes and actually adds to it. So security of information is extremely important to everybody. So even if you have a different QR reader that does go to a URL or a database or a third-party repository of information, that will not decrypt that information.
Wow.
And that is where we have our patents. And our patents are on the ability to encrypt and encode information into a QR code. And the reason why we created the patents weren't really so that we can make all this money or anything like that, but we wanted to prevent the Me Too's. So instead of having another company out there take the idea and create a similar product, we just say, why don't you partner with us so that this can be a benefit to everybody. So everybody's speaking the same language. And again, just trying to improve the efficiency at the provider's office, but also providing better care for the patients. Because now we're taking a process that, as I said before, takes 15, 20, 40 minutes, and now it's less than a minute.
Wow. Do you think, I think this is a pretty obvious question, but do you think people, when they're filling out paperwork on a tablet or a clipboard with 14 stacks of paper on there, do they get so tired of filling out paperwork that they actually will provide less information because they just want to stop writing?
Absolutely, 100%. The more times that you are asking an individual to fill out the same form, the quality of that information goes down. I like to use the example of actually one of my very close friends who's an investor in the company, who is one of the biggest spokespersons for MINA. And we were talking one time, and he had to go to the doctor for an issue. And he was filling out the form. He's like, I don't even tell them about, when I had this thing. Right. I don't even tell them about that because, that's not what's important for this encounter. Mm-hmm. I apologize. That's not important for this encounter. And I spent, the next 5 minutes saying, no, that information is actually important, that if you don't fill out those paperwork or that information or that data set in its entirety, then it actually puts you at risk as a patient because there may be something that you don't think is associated with this visit that may in fact be important in terms of your next treatment option. And 100%, those stacks of papers are either illegible, incomplete, or not even really having the effect.
So I looked up a statistic before our interview, and it was really interesting. They said that there was over, what was it? I got it written down. It was 860 million doctor visits or physician visits per year in the United States alone, just in the U.S. They said that per 100 visits, or per 100 people, there was almost 3 visits per year. So what I'm imagining is, from a healthcare professional's perspective, if there's 860 million visits a year, we're talking about 860 million sets of paperwork, sets of questions. And the first time somebody fills it out will have a higher quality of information
Correct.
than the 10th time somebody figures it out, because there does become an exhaustion point.
Correct.
So let's talk about how both patients and healthcare professionals win and benefit from MINA app. So let's talk about the patient first. We've talked about the quality of information, but how does the quality of information improve their quality of care?
I mean, so the quality of the information improves quality of care because, as I was trying to explain earlier, is that there are aspects of your history that maybe small aspects of the history that you as a patient don't understand the correlation, will actually change what types of treatments will be given to you going forward. Another example is, I'm now 43, so at 45, I need to start getting my screening colonoscopies. Everything goes well. You don't need to get those every year. They're every 5 years, or depending on your risk stratification. If I transition between health systems and I'm a new primary care physician to myself, and I don't remember when that last colonoscopy was done, I may be at risk of having redundant tests performed that are unnecessary because I just don't have the accurate or the most accurate information. I actually spoke with one of my colleagues years ago, and he said it is easier for him to recheck a hemoglobin A1C than it is to try to dig it out of the medical history.
I think that probably resonates with a lot of people that are watching this. So the quality of information can improve the quality of care. I'll just tell you, I don't mean to be cheeky, but my quality of care would be greatly enhanced if I didn't have to go through the frustration of waiting at the doctor's office for 45 minutes before I got in to see the doctor.
Absolutely.
Right? Okay. Let's talk about the doctor, the physician, the healthcare professional. Let's really dive in, because this is going to impact the people who are watching this the most. What does the MINA app, what are some of the probably the top 2 or 3 things where a doctor or a physician will immediately feel the impact by deploying the MINA app?
The more providers and doctors that I talk to about MINA, the more they say is, why did it take us so long to come up with this? Almost all doctors immediately, once we get past the initial formalities, say, I see the utilization. I see how this will make my life better. Mm-hmm. It allows for that bottleneck to go away. It allows for them to capture improved data points for the medical history. It allows them to provide pretty high quality care pretty efficiently, and it actually decreases clinic visit time. You don't have to go through again some of these data points. It helps their quality of life because documentation, at the end of the day, that documentation time goes down. And ultimately we're here to provide high quality care. So
absolutely. And I know that you and I have had this conversation a couple of times, but talk about how the MINA app can have a financial impact for the provider as well. I mean, there is tangible financial impact that they can benefit from by deploying the MINA app.
Correct. Absolutely. The efficiency is the reason why we created it. But all the providers understand that in order for us to improve our billing quality, that these data points that are in the health history need to be met. And that includes documentation for things like chronic comorbidities, medications, allergies, social history. I'll even say to our providers out there that the MINA app actually has a social history and a review of systems. So these type of things just add significantly to our workload repeatedly throughout the day. And many times we will sit back and say it's not of significant benefit to ask these additional questions to get that higher quality billing.
Mm-hmm.
But what this MINA app does is it takes that process of collecting that data and puts it under, in less than a minute to just scan that QR code. You have that entirety of that medical information, and it cuts through all the fluff, and it just gives you the meat of the medical history. And so with that, it supports higher level billing, higher coding level, that can pass auditing services and things like that. So
awesome. So just to highlight some of the benefit, I mean, it reduces time in appointment. I mean, it gets your calendar back in check.
Correct.
I'm just going to throw it out. It reduces the frustration that patients have towards you. The passive aggressive nature of them coming in, mistreating your staff, mistreating you. I mean, that's a benefit. It allows you to provide a higher quality of care because you actually have the information you need to deliver. Higher billing. Now, healthcare providers, physicians, they understand this. Because of the quality of information you have, you actually get to bill at a higher tier or a higher level than you currently are with the information you're currently gathering. That's pretty significant. I know you've done a few anecdotal studies to see it. You've seen people's patient billing increase just by the quality of information. Is that right?
So yes, we've done some data models in a primary care physician practice would routinely see a potential increase in the profit and loss of around $140,000 a year by simply increasing the level of billing of coding by a single level, not even taking them up to a level 5, which they don't know what that means. But if we just take it up a single level and helping to decrease the bottleneck and the efficiency of the office, we're looking at around $140,000 to $150,000 a year.
That's phenomenal. Now, I know that one of the things that comes up as we've talked to providers is that they always enjoy new technology that can increase the level of care, but sometimes they have to pass that cost on to the patient, and that's another barrier of entry.
Correct.
Let's talk about the model with MINA. The MINA app is designed to be deployed from the provider's position. So this is not being sold to end users. It's not being distributed to end users through the MINA company. It's being distributed through your office, your clinic, so that your patients have it, and it's modeled in a way that you can deliver it to them for free. That's by design. There's a small installation fee for the physician's office so that it can be deployed and you can have the access, you can have the patented QR scanner so that it can read only their information. There is a small monthly fee to use it, but it's such a marginal fee that it does not need to be passed on to the patients. I know that you have a big heart. I know you have a sensitivity towards the marginalized and maybe the less privileged. And I think that the way you've designed this probably reflects some of that, so that the cost is not being passed on to the patients. Is that right?
Absolutely, 100%. And I do have a bleeding heart for the marginalized. It's part of my past as I am growing up. And so at no point in time, as long as my wife and I are the co-founders, and will echo the same sentiments, is that we will not charge the end user. And the way that we created the app is also so that the marginalized end user will still have the ability to this technology. A lot of new technology is in a position that those marginalized cannot benefit from that. With it being a free app, and with it being completely offline, and with it being that you do not need cellular service or minutes, an old device after it downloads the app, that's the full version of the app. There's no add-on, there's no in-app services or anything like that. And so it actually, in the marginalized population, can become what I call a first generation EMR for them. And even greater than just, socioeconomic marginalized, because of the way we created the technology and the encryption into the QR code. We don't encrypt letter for letter into the QR code, and we actually have a third-party identifier. And then when we decrypt that information, we tag it back to the original data set. We actually took the entirety of the app and we translated it into Spanish. And so if English is not your primary language and Spanish is your primary language and you're in the United States, you can actually enter all your data in Spanish, and then the provider can pick which language they get that information. So it actually translates. Earlier this year, again, speaking to my bleeding heart, don't let everybody, I decided to, because I was looking at the migrant population overseas and the war overseas, we translated the entirety of the app into Ukraine. So if you're primary Ukrainian, you can put that in your primary language. We translated it to Polish. So if they go to a Polish-speaking provider, it'll translate. We're trying to help.
Yeah, that's obvious, and that's great. When you talk about the marginalized, we're not talking about the marginalized just within our borders, our states, our cities, our country. This app can be taken to a third world country on some type of philanthropic endeavors, some type of outreach, and the data can be stored in a phone that doesn't have cellular, doesn't have Wi-Fi, and it still has all the protections that it was designed for, so that a provider could actually be, I think we talked about, on some type of humanitarian effort overseas, and they could use a phone that's not connected to the internet or connected to cellular through the app to capture records and be able to revisit that population and have all the information.
Absolutely.
That just seemed, that makes this very global. Okay. We've gone outside of the healthcare provider's office, and now we're in Uganda. All over the world. It really allows that to happen. That is phenomenal. I really appreciate what you've done. I really appreciate you being here. Before we start winding down, is there anything about MINA app that we haven't talked about that you want to make sure that the providers that are watching this really understand and really can use as a basis to make a decision on whether or not they put it in their practice?
I said it already, and I want to say it again. And, I hope that it comes across to everybody here and the watching the recording, is that we created MINA to help. All right. This is standard information that is required 8 million times a year in the United States, but it is around the globe. I like to say everybody that breathes air has a health history. And we are trying to empower those people to have their health history. We want to help those patients, but we also want to help the providers. The pricing model is created so that it is a cost savings. Tried to stress that a little bit earlier. It's free for the consumer. It's a cost savings for the provider. It provides the ability to provide better quality care. It reaches that last mile of individuals across the globe that we can't reach to help provide better care for those individuals. We're trying to help.
It's quite apparent, and I congratulate for that. I think it's very admirable. I've been waiting this entire interview to say what I'm about to say. Patient data should not be brain surgery.
That is true. But if it was, I'd have that covered.
I've been waiting to say that one ever since we've been sitting here. It just popped up. No, what we'd like to do is officially invite you to reconnect with a member of our team that you've already spoken with. This is going to be an opportunity for you to ask some final questions to find out how this can be deployed and installed and implemented into your practice, and how you can start benefiting, how your patients can start benefiting. You can use the MINA app to do a lot of different things. And this simple technology, I think Jair said it best. Where's it been? Okay, where has it been? And I think it couldn't have come from a better person, and a person with a better scope on how this works. An actual healthcare provider is the one that designed this, and I think that would resonate with you. One of the goals that we had today was I wanted to make sure that the providers that are watching this got to hear about the app, not just from our team internally, but actually got to hear from one of the co-founders. We just thank you for what you do. I'm sure the people that are watching this thank you. And thank you for your time. I really appreciate it.
Thank you for having me.